Good morning. I'm Doug Wood, the Chief of Cardiothoracic Surgery at the University of Washington, and I'm very pleased to help moderate and lead this discussion of work-life balance in cardiothoracic surgery. A more unusual topic for cardiothoracic surgeons who are often not complimented for their ability to have work-life balance, but that's exactly why we want to talk about it today, because it's more and more something that we appreciate in terms of our own health and balance in life, as well as something that we're trying to model and make a better specialty for young surgeons that are coming up and that we're wanting to recruit into the specialty of cardiothoracic surgery. So we've developed a great spectrum of experts on the issue of work-life balance here today, and I'll have them introduce themselves, starting with Dr. Shaw.
I'm Fawwaz Shaw. I'm a cardiothoracic surgery resident.
I'm Emily Farkas. I'm an adult cardiac surgeon.
I'm Nahush Mokadam. I'm an adult cardiac surgeon and surgical director of a heart transplant and MCS program at my institution.
So to start things off, I think it's useful to even answer the question, what is work-life balance? So Nahush, what does it mean to you? What's this work-life balance issue mean when you hear that term?
I think work-life balance is really having the understanding of yourself, of what's important to you outside of work. It's can be called inscape, but it's really that self-awareness that there is a life outside of work, and everything we do at work, as busy as we are, doesn't always end there. That we do go outside of the hospital, we have a life, and we need to recognize the importance of that life.
And why is that important? You know, why do you think why are we talking about that today?
Well, last time I checked, nobody's actually truly a resident anymore in the hospital. We do live outside the hospital, and it's important to recognize that part of our value system, part of our reward system comes outside of the hospital, just as we get rewards and values from being inside the hospital and at work.
So Emily, let me turn the question to you. So you know, that's Nahush's explanation. What's your feeling of work-life balance? What does it mean to you?
Well, I feel similarly. I think it's about sort of balancing your professional and personal fulfillment, and I think those necessarily overlap to a certain extent. Everyone's satisfied by a job well done, but I think when they become one and the same, that's the danger zone, and I think it's unhealthy. I think if those were polarized, they'd be unhealthy as well. So I think it's important to personally define, excuse me, what it means to you, and then to sort of actively go after that and pursue it and intentionally craft your career so that it meets those requirements by your definition.
And why do you think it's a problem in cardiothoracic surgery?
Well, I think as a specialty, I think we really prize tradition, the way it's always been done, pattern repetition, and I think those come from a very valid place of patient safety and minimizing error, but I don't think you can be formulaic or apply that recipe to the subjective lifestyle expectations. So I think our specialty needs to do a better job of sort of evolving with the lifestyle expectations that we all have.
And I guess I'd ask you this specific question. Does the cardiothoracic surgery lifestyle discourage recruitment of talented women and men into the specialty?
Yeah, I think the answer is yes. I think that medical school matriculants are very savvy about these issues, and I think they're very keen and astute to what it means to have balance, and I think they look at us very closely and answer the question for themselves about what it's going to feel like to be a thoracic surgeon and what kind of balance they would have in their life. So I think we're important role models for that, to attract them to the specialty rather than discourage.
So Fawwaz, that's a good segue to you. How would you express, you're in that area right now, you're a resident now. Our current residents and medical students, are they more attentive to work-life balance than maybe my generation has been? And how does that impact our recruitment into the specialty and people wanting to go into cardiothoracic surgery?
Yeah, I think there's no doubt that our current generation of residents and students are more proactive in trying to seek out environments that foster better work-life balance for them. However, I don't think that the problem for our profession, for medicine in general, is a new one. I think, nearly 100 years ago, Osler said that we don't create any time in our very habit-driven souls for the lighter things in life that add value to it. And so I think the fact that it has taken us 100 years to have these discussions at this level just exemplifies how difficult it is, to overcome as a problem. And I think certainly residents and students are looking more at achieving better work-life balance when they pick a program that they want to be a part of.
Do you have any insights or advice on how faculty can better support and model work-life balance for you and your peers?
Certainly, I think Emily is absolutely correct that the problem becomes much larger when work and life outside of work becomes one. And I think promoting an environment at work where residents and faculty as well are happy and there's increased job satisfaction, I think reduces some of that the stress associated with the profession and with their jobs on a daily basis. I think faculty can promote faculty members, administrators that model work-life balance, and I think there's some element of mentorship that is associated with that. And I think on a very basic level, on a very day-to-day level, I think residents that have mentors or examples within their programs that model great work-life balance is useful.
And what would you see as the big challenges that residents face in home life and activities outside of the hospital currently?
Yeah, I think things have progressed on a technological level that we no longer differentiate work from home, and it's not infrequently that we communicate by email at 11 p.m. at night regarding patient care issues, and we might be in different states or with our faculty members doing different things. And so I think the ability to distinguish home from work has been blurred a little bit by technology, and I think technology is one of the huge barriers that we have to overcome in order to be able to separate work and time that we spend at home. I also think there, for me, for example, the new duty hour regulations, or the now old duty hour regulations, while they had good intentions, may not necessarily foster the best work-life balance. And for example, if I would like to do something fun with my kids on the weekend, it's almost impractical to do that with a single 24-hour period off. For instance, it's much nicer to be able to work 2 weeks and then have a weekend off. You can go camping for a weekend or something like that. So I think these are little barriers that we don't think about, but they somehow impede what we're trying to achieve in the broader picture.
So Nahush, let me turn back to you and ask maybe an obvious question. Would we be a better specialty if we developed a better lifestyle associated with cardiothoracic surgery? And if so, why?
Well, I know I'm preaching to the choir. I think we're already a fantastic specialty. And what we can do to improve our specialty is be aware and recognize that there are other elements that are important to us other than coming to work. That balance is, as already been mentioned, it's a personal thing. What's a work-life balance for me is going to be different than what's a good work-life balance for you and for Emily and for Fawwaz. That's our right to determine our own work-life balance and be clear that, you know what, if I just need to get to a basketball game on Friday night with my kids and that defines my work-life balance, that's great. And if it means that I have a weekend off, that's a different work-life balance. And if it means that I need 3 days off because I'm a part-time surgeon, so to speak, well, that's somebody else's work-life balance. And we have to be cognizant that everybody defines their work-life balance individually.
So there's a reason we're talking about this. There are a lot of pressures on cardiothoracic surgeons and traditions of cardiothoracic surgeons, overt and unstated. What are some of those that challenge our better accomplishment of work-life balance?
It's interesting. You know, our whole careers, we've striven to get excellent grades and excellent evaluations and match at the best programs and get the best training. And then when we enter practice, to get great results and develop wonderful relationships with patients and families and referring physicians. And everybody wants to take advantage of our type A personalities. Everybody's willing to do that. The administrator's willing to do that. Our bosses are willing to do that. And if we allow that to happen unfettered, it will. It can consume you. So it's our responsibility to remember that that's what's happening and say, you know what, this is important to me. That's not important to me, and this is how I'm going to strike that balance.
So some of it is that there's a culture within the specialty of work ethic that we never want to be the lazy one, the person that is actually going home instead of staying all hours of the day and night. And then there's other aspects, academic pressures for academic surgeons, financial pressures, you know, RVU finance driven, that are also impacts. How do you see those affecting us?
Well, many places are driven by that productivity model where you're defined by the number of cases you do or the number of RVUs you bring in or the number of papers you write. I think across the country we're seeing a pattern where more and more programs are moving to a strict salary-based model without productivity incentives to allow for better balance of other interests, meaning faculty development, resident teaching, other elements of work that are important that will also then lead to leadership, improve morale. And I think if you improve morale, by definition, as Fawwaz has already mentioned, you're going to improve work-life balance. If you're happy coming to work, you're going to be happy when you leave work.
Yeah, I think it's a great point. And Emily, as we've talked, you've developed really a fairly unique career path that's had value and meaning for you. Tell us a little bit about that, you know, what your career path is and how it works for you in terms of a high value, in terms of your professional career, but that fits with what you want for your life.
Sure. So I feel very fortunate. I spent 5 years on the faculty at a university and was grateful for the support and mentorship that I had from colleagues. But I felt like, from a personal standpoint, I wasn't as fulfilled as I wanted to be, and had been involved in many humanitarian efforts in the past, wanted to focus on that more. And so I stepped outside of that mainstream, and now I do a humanitarian mission every 6 to 8 weeks in a different country. And in between, I pursue sort of high volume, recurring operative per diem positions where I can maintain my operative skills and stay relevant with technology and so forth. And so I've found a way to sort of craft that career that can give me both the personal and professional fulfillment that I had desired. And it's outside of the box a little, but it's been quite fulfilling to me.
Well, I think a lesson to take from that is it doesn't necessarily have to be exactly what you've chosen, but that there are ways outside of the box for surgeons to think about crafting a career that might not be traditional, might not be exactly what I've done or in a traditional way, but allows one to be very successful in terms of accomplishing professional goals that's unique or different and doesn't have to follow the model that we're all used to.
Absolutely.
Fawwaz, there's an increasing emphasis on things like wellness programs and other areas of industry and work. How would they fit for us? Would wellness programs that are either developed at the hospital level or that are maybe developed by our specialty society and endorsed that would help cardiothoracic surgeons take better care of themselves and better care of their families?
Sure. I think you're absolutely right. There more and more programs, more and more hospital systems, universities are moving towards the creation of these wellness programs, and some of them offer incentives for utilizing them and participating in them. My own institution, for instance, has a graduate medical education wellness program that sends weekly emails on Thursdays that will highlight activities that are happening locally for that weekend. Also, I think an integral part of a wellness program, especially for residents and medical students, would include things like stress management programs, as well as time management courses. I think these are things that if you're not able to grasp and adapt to early on in training, can become overwhelming. If there's no way for you to manage your 5 discharge summaries that you need to do at 5 p.m. in the afternoon, and you're there until 1 a.m. doing 5 discharge summaries, then I think that sort of environment creates problems in work-life balance. I also think that the creation of the wellness programs in of themselves are not an end. I think we have to achieve some level of personal honesty and humility in being able to use these services whenever we need them. I think many places may have them, but residents, they're underutilized, or residents are not participating in them. And I was very interested in that while preparing for this, and so I looked at what our own institution has achieved. And in the last month, there were, I think, 31 scheduled appointments with a counselor for the residents in the entire university system, not within the cardiothoracic surgery division. But it certainly, I think we're moving towards being able to better utilize, some of those resources.
Nahush, what are ways that departments or our hospitals can work to educate and model work-life balance for our faculty and for residents?
I think that's one of the hardest things for us to do as a specialty, and I think it actually begins with the leadership. It's the recognition of somebody who is not achieving a work-life balance, and implementing mechanisms to prevent that from happening. As I said earlier, everybody's more than happy to take advantage of the fact that we're willing to work hard. We've been doing it our whole careers. And if it's just one more case to do, well, we'll just do one more case. And if it's one more referral to see, one more patient to see in clinic, in general, we're a bunch of yes people. We say yes to everything. And I think the importance is for the leadership to recognize that, no, you shouldn't say yes to that. Go ahead and say no. Empower people to say, we have limits. And I think that's one of the key elements on what you can and how you can educate your own faculty and residents, and recognizing that people are allowed to have limits.
Yeah, and I'll say that I agree with your concept that it's very important for leadership to recognize and model an effort to endorse and support our outside lives. And so I'll speak from that perspective. When I told my wife that I was going to be involved in moderating this session, she of course laughed, thinking that I was far from an expert on this area of work-life balance. And I think that there are generational issues, then it's very important for my generation of surgeons who are often in the leadership positions to take a step back and to recognize generational differences as well as potential flaws that we have had in our past models of work ethic that were totally devoted to our work, to the exclusion often to our families or our own health. And I think that rather than labeling wellness efforts or alternate career paths or decisions to say no as a violation of the culture of cardiothoracic surgery, I think that at the leadership level, we need to recognize that these are actually improvements in how our faculty and residents are performing and are having a satisfied and productive life professionally and personally. And that makes our specialty better by making it more attractive to recruiting highly talented women and men into the specialty. And I think that's also what we want to do, is we want the specialty to continue to be a vibrant, terrific specialty. And I know that we all have different aspects of whether it's exercise or a hobby or making sure that we make it to the basketball game or go camping with our children, that those are things that are as important as making sure that another case was done or that every last consult was seen, because we have partners also to share that work with. So I just want to thank all of the panel that have been willing to share some of their thoughts about work-life balance and cardiothoracic surgery. Something that, you know, in my own life, and I think in many of our careers, is a daily challenge. It's not something that we have figured out. It's something that we try to figure out every day and try to balance our priorities at the hospital and our priorities with our families and with ourselves. And so I hope that this will help all of you think a little bit more about balancing what we do at home with what we do at work. Thank you very much.